Hi, everyone. This is Paula Harris, and I have with me Dr. David Sutton. Dr. David Sutton, how you doing this morning?
Doing good, Paula. Thank you for asking.
Yes, yes, and I'm excited to have you talk with us today. I think you are probably one of the most ambitious dentists that I've ever met. I don't know if that's something you would call yourself, but I think
No.
you are, just from what I know about you. And when you look at your bio, oh my goodness, you've done everything. You've done the implants, your air abrasion, you've been a CAD CAM, you've been a trainer for CIRAC too, haven't you?
For the local dentist in this area, yes.
Yes. And
Yeah,
then you've done biomimetic, which a lot of people may not even know what that is. Can you tell us
and
briefly?
they should. They should know.
Okay.
I'll talk about that soon.
Okay, good. And so you've done ortho, you've been in private practice for a long time, and now your son is in practice with you, right, Dr.
Yes.
Joseph?
Yes.
Okay. And you're in Newport, Tennessee. And I am excited to have you today to talk about ozone, which I bet you a whole lot of people aren't doing much with that, but I know a few doctors are, and you've done some fascinating things. I've been in your office when you talked about this, and you actually made some. So
And I
I'd love,
drank some as well.
yeah,
Yeah.
right, yeah. I drank some as well. So I'd love for you to just share with us a little bit about your story, how you got into dentistry, a little bit of your background, whatever you feel comfortable sharing.
Okay.
Okay.
So that's my cue to get started. And I'm one of these fellows that never did think about going into dentistry. I was kind of a lost child out of high school that worked in a plant a few years to pay for my way through college. And one thing I found out is I didn't want to work in a plant the rest of my life. And after about a year of going through college, my parents finally said, "Why don't you become a dentist?" And so my mind's always, well, why not? I try to think the other reverse, and I couldn't find a good reason why not to be a dentist. And so that's one of the few times I listened to my parents, and I went into the dental field, and I really never have looked back. I really love it. It gives me the ability to help people. I get to work with my hands that I love. It gives me the freedom of choice and being my own boss. And I thought at the time I could go and work anywhere I want to, and really in the world, because wherever there's people, there's teeth. I turned out going back to my hometown I grew up in, because I just love East Tennessee.
Mm.
So that's why I became a dentist, because I couldn't think of a good reason why not to be. It was a good choice.
And it's worked out well for you, very
It
well.
has worked out very well, and I kind of consider myself kind of like a wild card in dentistry, because again, if someone says I can't do something, I'm always saying, well, why not? For me, the word can't shuts down your thinking. And so you don't ever tell me I can't do something, because I'll try to prove you wrong.
That's right.
And dentistry is no different. So turns out that I probably run my practice a little differently than most people do, because I'm always looking for a better way for my practice, my staff, and of course my patients. Uh, I've always had the philosophy that I put my patients' health first. My second, close second would be the staff's welfare, because if you don't have a good, solid staff, you're not going to have a good practice. That kind of put me third, because if you put the other two first, you're going to be right up there with everybody else. And of course, insurance I always try to put last.
Yeah.
You can't work for the insurance companies, that's for sure, or it's a lost proposition. Being kind of a wild card, I'm always looking for a better way to help my patients out. And well, ozone's the latest thing I'm doing here.
Yeah, and it's really a pretty cool thing.
It's a pretty cool thing.
Yeah.
I could get into a lot of other things. I actually started steering away from what I was taught in dental school in the late 90s. I started out saying I need to be a more conservative dentist. So I started getting away from crowns and root canals. I stopped doing amalgams. You mentioned abrasion. I started that in 1996. And that led me to Raymond Bertolotti about bonding. And
Oh yeah.
I feel like he's the man on bonding, and he still is.
Yes, he is.
And it's been a progression of improving my techniques, my bonding techniques, and trying to get more conservative all the time in my dentistry. And that led me, of course, to CEREC and getting away from more crowns. And I think I got the CEREC machine in 1998. It was a CEREC 2 at the time, and it was a hellacious thing to learn how to use, but I did learn. I joined the Biomimic Association back about 4 years ago and went to Reno, Nevada. And that's where I learned about Dave Allen. And and then I found out that he was teaching a course in Knoxville. I got very excited and joined there. And I learned a lot of things from Dave. I thought I was doing a great job, but I learned more things. And this leads me to a subject that goes right into ozone, is you got to have an open mind in dentistry. If you're not willing to learn, you stop learning, you're going to stop changing. And one thing in life is for sure, there's always changes. And if you don't go with the changes, you're basically going to be dying, so to speak. And so it's important to keep an open mind and change.
You're absolutely right about that. And that's hard for the team sometimes. They kind of push back. But your team, they're dynamic and they embrace it for the most part, I think.
Yeah, I'll get an ozone. That's the first thing I knew I had to do if I was going to introduce ozone to practice, is I had to get the staff on board. And they've got on, I'll get on that in a minute, but they really got on board on it. We'll go back into that a little bit later here. Let's see here. Any other questions you asked me, Paula?
Well, yeah, I wanted to know why did you decide to start using ozone? Like, what just kind of compelled you to, like, this is something I got to do?
Well, it really had to do with the biomedical dentistry. I first heard about ozone about 24 years ago.
Oh,
wow. I listened to Ray Bertolotti.
Okay.
And he was saying they was using this ozone gas in Australia. And they were actually ozonating caries teeth and leaving decay in and sealing them up with glass armors. And the teeth were remineralizing. I thought, that's great, I'm going to jump on that. But the problem was the equipment they were using wasn't approved by the FDA. So I said, well, he talked like it's going to be approved here in a few years, so I'll just kind of sit back and wait for it to get approved in the United States to be on the safe side of using the United States. And so I kind of sat back and kind of forgot about it, but it was always in the back of my mind. But when I got in the Biomimic Association, there's a lot of guys using it. It kind of rekindled my fire to start looking at ozone. So that's when I really started getting interested in it again, was about a couple of years ago.
Yeah.
I've just learned there's a lot of wonderful things about it. And one of the first things I learned was it's nothing new. It was first used in medicine and a published textbook on ozone medical use in 1885.
Oh my goodness, it goes way back.
It goes way back. It was in the Florida Medical Association. It was published by Dr. Kenworth. And the neat thing about that is the FDA didn't come around to 1906.
Oh.
Okay. And so kind of what's happened is ozone is grandfathered in the medical field, and the FDA really can't do much about it other than improve medical equipment for the use of it.
Well, there you go.
But as far as using it in your dental office, you don't have to have FDA clearance approval for it. It's already grandfathered and already approved for everything. And so when I learned that, that's when I gave me the okay to start using it. Okay.
Right.
And the next step was in using ozone is, golly, you can't just get any ozone equipment. You need to get one that's a medical grade, because ozone is a very powerful oxidizer. It will oxidize a number of things, and you don't want to oxidize plastics and inject in people's bodies. You don't want to oxidize metals and put the oxidized metals in people's bodies.
Wow.
And you sure don't want to inject nitrous oxide in there, which happens when you ozonate just plain oxygen that's mixed with nitrogen. Because ozone will oxidize the nitrogen in the atmosphere as well and create nitrous oxide. So you also have to use a medical grade pure oxygen, those green bottle tanks.
All right. That makes sense.
But I'm not too concerned about the legal aspects of using ozone in the office. So
Well, I'm glad you brought that up, because I do remember back in the 90s that coming up and talking about it, if we're approved to use it. So good point there. So what I do want to start with how you use it, or what the benefits are. I mean, why are you using this? Why is it so important to use it?
Well, I'm looking at the patient's total health nowadays in dentistry.
Which is important.
Dentists need to put the mouth back into the body, because that's where it really is. It's the first organ in the digestive system that we really need to take care of. And there's a Dr. Bradley Bell, that's really pushing the oral systemic link. And I'm actually a patient of his now, and I have some issues. I might give a little bit of my own testimony on things, but one of the things I've learned in reading books, and Dr. Bell helped me, is I didn't realize the bacterial flora in your gut is so important. It actually is like 70% of your immune system comes from your gut.
Yes, we're finding out more and more about that.
Not only that, but the gut also actually produces neurotransmitters and communicates with your brain. You ever heard the expression, I have this gut feeling?
Yes.
There's some truth to that.
Yeah.
And the problem in dentistry, when we start prescribing penicillin and all these systemic antibiotics, guess who else we're hurting?
Yeah.
The microbes in the gut. And we really need to get in dentistry where we try to treat most infections topically and locally, not systemically, and compromising our precious bacteria in our gut. All right. So one of the reasons to use ozone is to fight infections and do it more topically and locally in the mouth, and stay away from the systemic drugs. Of course, so you always want to have emergency situations where you must have to use systemic antibiotics.
Yeah.
But that should just be when it really gets to be an emergency type situation.
Okay. So when you're in certain procedures, what certain procedures are you applying the ozone?
Well, ozone can be applied in a number of ways. It can be applied in a gaseous form. It can be applied in ozonated water form. It can be applied in an ozonated oil form as well. So So the application depends on what you want to do with it.
And it loses its effectiveness pretty quickly, or the half-life, or what you were telling me, it lasts longer in the oil suspension than it does.
Yes, the half-life with ozonated water is about 6 hours.
Okay.
So if you get like 30 parts per million ozonated gas in the water, in 6 hours it'd be 15. When it gets down to 5 parts per million, it gets not very effective anymore. Ozonated oils, what happens is the ozone reacts with like olive oil, and you produce ozonites, and they're much more stable. They can be on the shelf for several months, and if you put it in the refrigerator, it'll last for several years. The gas is very limited. The half-life on it is a lot less, and so you have to make it in your office as you use it.
Okay. Then do you use it for, like, I know you don't do a whole lot of crowns, but for fillings when you're prepping and you see decay, is that an application where you would use it, or what procedures are you using it in?
There's a lot of procedures you can use it in. Actually, I have used it for root sensitivity. It's another method of desensitizing roots.
Nice.
If you have a pulp exposure, and you do a pulp cap, generally a lot of times that's a failure because you really can't get rid of all the bacteria in that exposed site. And if you use ozone to treat the pulp exposure, you're pretty much going to have near 100% success of it working and not needing endo.
Yeah, nice.
There's been studies where they've done rats and done nerve exposures in a sterile environment on their teeth, and the pulps never die. It's the bacteria that kills the teeth, and if you can kill all the bacteria and seal it to where the bacteria can't get back in, then the nerve is just fine. I've also used it for periapical abscesses, where I inject ozone gas into a fistula and just kill the bacteria that way. Ozone, as far as I know, is the only, if you can call it a drug, it's the only drug that can actually kill all the bacteria in an infected dent. It'll go down, I forgot, a depth of about maybe 2 or 3 millimeters deep. So it can actually leave tooth decay in a tube. Like I learned 20 some odd years ago from Raymond Bertolotti, you can kill all the bacteria in the dent. As long as there's still some collagen fibers there and dental tubules, and seal it, and all that soft dent will remineralize and get hard again, because tooth is living tissue. And if you give it a chance, it'll heal from the pulpal tissues.
That's fascinating.
The biggest thing I'm really pushing right now with the ozone is my water lines. The standard of care is like, I forgot the unit measure, but it's 500 parts per something, which is pretty much the same as our drinking water. You can get your water lines down to that biofilm concentration, you're okay. But with ozone water, it actually gets down to 0. All right, which needs to, I need to point out a fact about one of the unique properties of ozone. It's just so lethal against microbes. It carries a negative charge, and all your microbes carry a positive charge. And they really attract each other. And what the ozone actually does is a powerful oxidizer. And the fact that microbes have no antioxidants, it just burns a hole in their cell membrane. And the byproducts, when it destroys that microbe, creates a lot of peroxides and such, that just creates a chain reaction. And it's just like shrapnel in a hand grenade. You got one blow, but there's a lot of little pieces from the microbe that go to the other microbes and kill it. And so it's kind of like a chain reaction. which puts one molecule of ozone is about as powerful as about 3,500 molecules of chlorine and chlorine water. And so a good illustration would be like if you had chlorinated water and you had 4,500 microbes, you would take 4,500 chlorine molecules to kill those microbes because you don't have this cascaded chain reactions. And it would take about 4,500 seconds to kill all the bacteria. Wow. With ozone, if you had 4,500 microbes, with one molecule of ozone, you can kill all those 4,500 in like 1 second.
Wow.
All right.
That's
so you know, like the compounds you use to disinfect and wipe down, you have to wait like 10 minutes. Use ozonated water, wipe it down. There's not much of a wait time, and you don't have. I'm getting into disinfecting the surfaces here, but you don't have it. Water, you won't damage your coverings on your chairs like all these other compounds will.
Nice. That's a good one.
But back to the water line, I got off track that because it's so quick and powerful killing the microbes, you can put it in your water line and it'll keep it absolutely pretty much sterile.
That's great. And that's been in the news a lot, you know, about water lines.
Well, actually, there's been documentation of people dying from Legionnaire's disease from the biofilms in some other countries.
Yeah.
So it is an issue that all dentists should be addressing, but it's not pushed in our industry because who can make money off ozone? I mean, they're selling. I had these iodine filters that I was going to have to spend about $3,000 to replace because you got to replace them every year. And golly, I bought an ozonated unit for that price that will last forever. But you know, they can't make money off ozone. The problem with ozone is like trying to patent water.
Oh.
Okay. Ozone's a natural gas, and you can't patent it. So you'll never hear, you know, pushed into the industry and advertisements and stuff like that saying you really need it.
Well, I heard some of your team members talking about using this on gum tissue.
We do now. I had actually, well, I can't say who he is, or that would tell you this, but I had a dear friend or patient that we did a onlay on, and it was a real deep, and we had to use electrosurge, exposed gingiva, and the clamp was around it. He came back with post-op issues a couple of days later where the tooth was really hurting and tender, and it really wasn't the tooth. It was all the gingival trauma we had to inflict on the tooth to fix it up. I said, let's use this ozonated oil on here, and we just scrubbed it down there. We had a little bit of a pocket formation. I scrubbed it down the pocket, and the next day, he said, problem is completely gone. You look at the tissue, it just heals back so quick. That's one of the neat things about ozone is not only is it bactericidal, but it also carries the properties of being anti-inflammatory and actually kicks your body into turbocharge for healing. And that's another reason that I didn't mention. A good reason to use ozone is not only to stay away from systemic antibiotics, but also if, like, you take wisdom teeth out and you give the patient a dose pack of steroids, yes, it knocks down the inflammation, knocks down the swelling, but it also shuts down your healing ability. It shuts down your immune system as well.
Yeah.
Whereas ozone will do the same thing, and that it'll knock out the inflammation, but it puts your body in turbocharge to heal up. It actually boosts the immune system and it boosts the healing response. And that's when you go and inject actually the ozonated gas into like a buccal tissue.
Nice.
It produces a cascade of chain reactions that will help the patient heal up and help eliminate any possible post-op infections.
You know what
Since
I'm
I've been
thinking
using
too?
ozone, I also ozonate gas in the sockets, the teeth I extract, and seems like it really clots a lot quicker. And
Oh,
so far, knock on wood, I hadn't had any dry sockets or any post-op problems from it at all.
nice.
Uh,
You know, with the opioid focus of prescribing less pain meds, I could see this could support that as well. Is that what you're thinking?
well, I still give a very small amount of that, but
Yeah.
yes, it could very well help with that.
I
But
mean, less pain, less time with pain. Sounds like from what you're.
well, we're on the newses in the office, so let's go to the staff.
Okay.
One hygienist's daughter had a hepatic lesion starting on the lip. I gave her some ozonate. I said, let's use this ozonated oil on the lip. The next day, it was gone.
Wow.
All
That's
right.
fantastic.
I had another dental assistant whose husband was mowing and got smacked by a limb and had a bad cut on the forehead. Ozonated oil in that cut, it healed up in like 3 days.
Wow.
It puts Neosporin to shame. Because again, it promotes healing. It knocks out that. In the healing process, you have different stages, and the first stage is inflammation. Well, it completely eliminates that stage of inflammation, and it goes right into healing. Someone else had poison ivy.
Oh.
Again, it's a powerful oxidizing agent. And in the past, I'm very allergic to poison ivy, so if I'm in it, I always go to the bathtub, pour Clorox in there, and take the Clorox bath. Because the Clorox will oxidize the proteins that you're allergic to and keep it from having it. But you can do the same thing with ozone, ozonated oil, and just rub it on your skin. It will eliminate the poison. It's not just dentistry; it's a lot of other things as well.
That's true.
Treating it for autoimmune problems, cancers. It's just an amazing, again, if you can call it a drug, it's just an amazing drug. But you'll never hear it much in the United States because no one can make any money off of it. They're not going to research. You have to go to Europe, Cuba, other countries, and I think there's at least probably 20 countries that's really the standard of care to take care of.
Wow.
Problems.
That's amazing. You know, I'm just, it's so exciting. So I hope a lot of the doctors that are learning about this from you today, maybe they've heard about it, toyed with the idea, but they want to know more. Where would they learn more about it?
It's pretty easy to learn more. If you just get a course on Google and YouTube, you'll learn a lot.
Okay.
But I wouldn't trust that information. If you really want to trust the information, you go to PubMed. And there's literally thousands of articles written on ozone, some specific to dentistry, some not.
Okay.
You can actually buy textbooks. There's one specifically written for a dentist. It's by an Englishman. And the title of it is The Revolution in Dentistry. And it's by Edward Lynch. The book I like to read is a very easy, small book to read. It kind of introduces you to ozone. It's written by Frank Schallenberg, and it's The Ozone Miracle. And he has a website that's www.theozonemiracle.com. And there you can actually watch videos there that would be pretty reputable. And
That's
I've
great.
read several books, and I ended up going to a course that two dentists gave. Their names are Robert Harris and Phil Mosella, and they represent the American College of Integrative Medicine and Dentistry, and they're probably the big pioneers in dentistry here in the United States. And if you get really serious in using ozone in your dental practice, you need to call them, which is 201-587-0222. Because before I took their course, I knew a lot of this about ozone, but like all drugs, you got to know the dosage for the procedure and the treatment you're doing, because any drug, if the dose isn't enough, it's not effective. And if there's too much, it can actually become poisonous and harmful. And the ozone's the same way. So you got to know the dosage, and you also need what form of ozone do you need to use, whether it's gas, oil, or water.
Okay.
But that is a good place to start. There's also associations you can join. There's the American Academy of Ozonative Therapy. It's mainly for medical doctors, but I'm sure they would welcome dentists as well. And their number is 888-991-2268.
Okay. All right. That's great information. Yeah. So we want to be careful with it. I meant to ask you, are there some side effects or challenges? So, like you were saying, you got to get the dosage right. Make sure we're applying the right type.
No, there's not too many drawbacks. One thing I did buy this monitor that monitors how much ozone's floating around in our office. Because when I went to what is it, OSHA, I think, our friendly person that protects all of us.
Yeah.
They allow like 0.8 parts per million exposure to workers over an 8-hour work period. And so if you got a generator in your office making ozone, just for legal reasons, if the staff member says, I got this ailment because I was breathing ozone in the office, I'm keeping a record or a log and saying, no, the office is exposed to, so many parts per million.
Right.
On that. So,
that's good, because you're not supposed to breathe it, right?
Well, what it is, there's only 2 places in your body where ozone gas will actually damage it. What protects us from ozone is our body is full of antioxidants. So the ozone attacks these antioxidants instead of our cells, unlike the microbes. The problem is the mucus in our lungs and the mucus in our eyes doesn't have much antioxidants. So ozone becomes an irritant. If you actually breathe the gas, it'll make you cough like crazy, and it will irritate your eyes as well.
Okay.
So like if you're using ozone for lung problems, you got to bubble it through olive oil first, and then you're breathing ozonides instead of the ozone gas. So, that's the only harmful thing really in ozone is if you breathe it. But
gotcha.
You'll never breathe enough to really hurt you. You'll cough and leave the area and that'll get out of you.
Your body will make you stop, yeah.
It'll make you stop, that's right. But I really haven't found any challenges or drawbacks. The only thing I'm working on right now is trying to figure out how to get compensated for all the expenses I've gone through to buy a medical grade ozone unit and take all these courses here. And of course, extra time it takes to use it in the office. But don't worry.
Yeah.
There's a way.
It really does create a wellness sense, and I know that's something that you're very passionate about. So, are you available if a doctor has a question? Can they email you or?
Yes, email probably works best.
Okay.
Because I respond to all my emails, and that's basically my name at google.com. So it's David Sutton, DDS, at gmail.com.
Right. Very good. Okay. And and I forgot to mention about your farming expertise. Tell us a little bit about that before we go.
Well,
my
dad was an extension agent, and I had no choice but to grow up in 4-H, and I did chickens, cows, I cleaned hog pens out. I've done about every kind of farming there can be done. Dad and I grew cattle for about 10 years. And for the last 20, almost 30 years, I've been growing this tree called Paulownia. And that's my other passion in life is growing the Paulownia trees. And it's given me 2 trips to China where I've helped the Chinese grow the trees. and I've helped a lot of other people in this area. I'm currently president of the American Polony Association, and if anybody wants to know how to grow Polony or has some land where they think they like to farm Polony, it's actually a market there for the lumber, and I'd be glad to help people with that too.
Well, that's wonderful. So if these dentists are sitting on acres and acres of land and they want to know what to do with it, we can grow some paulownia trees. And I've seen some things you've made with it. It's really beautiful wood, and you're very skilled at that.
Yeah. Well, thank you. Yeah, they're a lot cheaper than growing horses. and they won't bite you either.
I guess not. Throw you off. Yeah, exactly. Well, Dr. Sutton, thank you so much for joining us today and sharing about ozone and lots of other things. You're a fascinating person, and I've enjoyed getting to know you. So I'm sure this is going to be a big, helpful information tool for lots of dentists out there as they listen. So thank you so much.
All right. Thank you, Paul, for having me.
All right. You're welcome.